Welcome, friends. This is Dr. Jaitly, your cardiologist from New York, on your favorite video site, MuniMeterHealth, which is on several social platforms. Thank you for being with us to help me enhance medical education and the patient education both. We are obviously having a whole crowd of medical fraternity amongst medical students, residents, fellows, and of course my colleagues, and the good patients and the general masses who can learn just about their illness and their health as well. And all of this is only to help improve the clinical outcomes, which has been clearly shown now the world over. And that has been my deepest belief all through my 40 years of my practice. So thank you again for being associated with MuniMeterHealth. Without any further ado, I'd like to delve into the subject matter. The short video vignette today is about sleep deprivation and the cardiometabolic risks. Now, we know there's a whole bunch of cardiometabolic risks that can prone oneself for coronary artery disease. And what are they? Hypertension, where the systolic blood pressure is now, the definition is that should be more than 120. Gone are those days where the definition used to be more than 130. So we're getting a little more tighter in our control here. And the diastolic is more than 80. So anything more than 120 over 80 would automatically fall into a hypertension definition. Of course, you may try not to put them on medications right away, but watch out for the next 2-3 months. Take several readings in between for several weeks apart, and then decide to put them on medications, of course, unless they are documentedly very, very high or moderately high. Central obesity, which is almost like apple versus the pear, as they say, and the central obesity is the criteria where a lot of people have looked at, and they found that this was a high risk for CAD in those individuals. Now, this could be genetic, this could be hereditary, but sleep deprivation is leading to all of these, by the way, and that's where we are discussing now how sleep deprivation. Now, what is sleep deprivation, by the way? And just so that you know, we can also define that quickly. Sleep deprivation normally is where one individual gets to sleep less than 4 to 5 hours. So less than 4 to 5 hours is the sleep deprivation by definition. Okay, so anything more than that, so in other words, one should be able to normally sleep at least 6 to 7 hours in order to call it a normal good sleep. So 4 to 5 hours is definitely very, very less per day. So that means 20 hours almost you're awake, and that's not good for all of this. Now, insulin resistance, which leads to A1C, which starts rising, and that becomes, and so does the fasting blood sugars, and therefore these patients eventually become diabetics. So that's another issue here. Again, these are the hyperlipidemia markers where the LDL is high. So obviously you have hyperlipidemia. And obviously these patients have propensity for low HDL. One, they don't exercise, and two, it's a genetic low HDL as well. That's contributing to it, and increased LDL in these individuals. So partly it could be because of the diet, because they're not moving around too much. They are mostly very stressed, and they are sleep deprived. And obviously the link is now clearly shown that less than 4 to 5 hours of sleep is not good, is not heart healthy, if you will, and leads to coronary artery disease, angina, therefore, and then myocardial infarction. We call it acute myocardial infarction, and even sudden cardiac deaths. Now that is very, very scary. Okay, so make sure you guys get a good heart healthy sleep, as I always say. And just like we have a heart healthy diet, a heart healthy sleep is very, very important for all of us. So please make sure you do that. And that's very, very important for all of us, because this way you can keep your coronaries in good shape. You can prevent the insulin resistance from developing, so you will not be a diabetic. And again, I think nothing like reducing your stress, spreading out your time, so this way you have a good time for exercise. And in fact, I think following exercise, one gets to sleep on that night rather more than ever. That's one. And and eating lesser meals, lesser portions, that helps a great deal, and timely meals. So meals have to be on time, and of course they should be smaller. So smaller and then timely meals are very, very important. It's not like you're having a snack at 10 p.m., 11 p.m., and 1 a.m., and that's not good, because that'll further lead to sleep deprivation, because then the digestion begins and everything else just goes wacko. So it's just a quick video vignette on this, mainly for our patients population, so this way they understand, and of course for our colleagues as well, so because they are very familiar with all these CV markers, which are the hallmark for cardiometabolic syndromes, if you will. Now, previously, cardiometabolic syndrome was also called as Syndrome X, because we did not know how Syndrome X was inculcated with coronary artery disease. Now, it turns out that Syndrome X, the diagnosis there is by a nuclear scan and EKG changes, but the important part is the angiogram may be negative in these patients. So just so that you know. Okay, I thank you again for associating with us on MuniMeterHealth, and stay tuned for more coming your way. Okay, and do write your suggestions, comments, and of course questions, if any, and we'll make it a point to answer those as soon as we can. Thanks again. So long. This